Now, many would argue that the United States of America is already facing a health emergency. But according to the U.S. Congress's attending physician, Brian Monahan, this could very well just be the beginning. He says that anywhere between 70 to 150 million Americans could end up being infected by COVID-19. To put these numbers into perspective, America's population is 327 million. So if Dr. Brian's projection holds, then more than 46% of America's population could end up being infected. These figures were quoted by multiple media agencies in the US even before Dr. Brian made his remarks. The numbers were presented to Anthony Fauci, the head of the Infectious Diseases Institute and one of the leading immunologists in the world. He warned against believing such predictions since they are based on certain rigid assumptions. Now, going by Dr. Brian's model, there could be 700,000 deaths in a best-case scenario in the US. And 1.5 million deaths in a worst-case situation. The focus right now is on testing. Can the US implement universal testing like in South Korea? Vice President Mike Pence claims that more than 1 million tests are available on the ground. But the Center of Disease Control has contradicted the Vice President, saying that the test kits lack the reagent needed to activate it. There are also reports of patients being denied tests despite showing symptoms of COVID-19. So how exactly is testing being done in the US? We'll let Dr. Nick Spano from Boston tell you his experience at a testing station.
Had a mask on as recommended if I had any at home, and I was greeted by a nurse who was the only one in direct contact with me. She had essentially improper contact precautions with the N95 respiratory mask, the same mask we use to prevent against tuberculosis. And I was then instructed to roll down the window. I was given a nasopharyngeal swab. It was a very thin swab, the same one that we use in the hospital to evaluate for the flu. And this swab essentially goes into your nasal cavity and will reach actually the back of your pharynx, why it's called the nasopharyngeal swab. And she had to do that twice, one in each nostril. One was for COVID-19 and the other swab was for our standard respiratory viral panel. And then she performed a oral swab, which went to the back of my throat. All these swabs are very uncomfortable. Now I know what patients mean when they tell me that they do not want a flu swab done. It's very, very uncomfortable, but obviously it needs to be done. And then I was given a discharge sheet of information with some general information about how to quarantine myself, and I will be receiving a phone call from the Department of Public Health of Massachusetts to be given my results of the tests.
Talking about testing, there is a growing chorus for US President Donald Trump to get himself tested, and not without reason. Take a look at this picture. The man you see standing next to Trump is the Brazilian president's press secretary. He has now tested positive for the virus. White House press secretary Stephanie Grisham has denied that the president was in close proximity to the patient. But this picture seems to show otherwise.